Okay, so I'm going to start out just with a little bit of transition from what some of the speakers are saying and some of the things that you're going to have today. Sometimes when we regard our own health care and our own thought processes as we're planning our life, whether we're planning to have a baby or whether we've had a baby and we're worried about having baby number two, one of the weaknesses that we have as humans is that we assume that our own experiences encompass everybody else's experience. So we just kind of assume that without explaining ourselves, somebody else is going to get what we've been through. And in a talk I read recently, a Yiddish proverb was brought out that if you're a worm in horseradish, you assume that the whole world is horseradish. So when it comes to planning and preparing for pregnancy, when you're talking to your girlfriends and you're talking to your mom and you're talking to your neighbors, for me, I have, there's 9 girls in our family. So when I'm talking to my sisters, if I assume that my experience is going to be the exact same as theirs, I may be putting myself in for some expectations that I can't follow through. For example, I have a sister, she's had 4 children, I've had 4 children. She's had her very first baby, she went to the hospital, and 2 hours later, she pushed 4 times, grunted a little bit, and her baby was born. Okay? So if I had set myself up for that expectation, on the Saturday before the Sunday that I had the baby, I would have already considered myself a failure. So in this world, we're not worms in horseradish, and the whole rest of the world isn't made of horseradish. Planning for pregnancy. For many people, it's a really good idea to schedule a preconception visit. Yeah, the notes aren't there, that's okay. So if you have particular health challenges, for example, if you have diabetes, if you had, okay, no, that's good, that has my notes on it, that's good, that'll be okay if it shows up there. If you have diabetes, if you're over 35 years old, if you've had a seizure disorder, if you've had any health problems at all, if you're very underweight, if you're very overweight, it's very good to get some counseling from your practitioner about things that you can do now to help you have and help you keep a healthy pregnancy. There are certain medications that are dangerous during pregnancy that need to be switched. There are certain medications that if you're taking them would be really dangerous and pose a problem to your baby during the pregnancy. For example, if you're taking testosterone, which a lot of young 20 and 30-year-old girls aren't taking, wouldn't even think about taking. But let's say if you try to take a testosterone supplement because you heard it gives you energy and you found something at the health food store, what if you're having a little baby girl and during those developmental stages you give her extra testosterone? What might or might not happen to her? There's just things that you did have a lady this week that brought me 5 bottles of supplements that she's taking. And she happened to be taking a lot of vitamin A, and that would not be a good thing for her to take. And then she was, in order for her to get the iron that she needed in her pregnancy, she would have had to take 6 of the pills, and she was sure, because it said on the bottle, that that was enough iron for her to establish and keep a pregnancy. Okay, next one. So I talked a little bit about iron, that's a lead-in to folic acid. So Dr. Kent Davis teaches an anatomy physiology class up at the college. He says if he could change one thing about the college, that he would make every single girl up there take a folic acid supplement, because he knows that it's good to have folic acid in your body in order to establish a good pregnancy. So guidelines say if you're not trying to get pregnant, go ahead and take 400 micrograms, mcgs, of folic acid a day. If you are trying to get pregnant, or if you are pregnant, take 800 mcgs, micrograms of folic acid a day. If you look at the label on the back of your vitamin bottles, some of them will say 1, and the 1 has the little letters mg beside it. That's 1 milligram, which is 1,000 micrograms. So let's say that you are a lady that had a baby before, and your baby happened to have spina bifida. When you have your preconception visit, or when you come to the doctor for the first time for your visit, your doctor may say, yes, for one of your 8 sisters, 1 milligram or 800 micrograms would be plenty, but for you, I want to cater that. You have special needs and you have a special situation, so I'm going to give you extra. I want you to take this amount. And they might even give you a prescription in order to get that amount of folic acid. Since we have known this information, there are many less babies born now that have something called neural tube defects. Spina bifida is an example of a neural tube defect that you might actually know somebody that had that condition. Okay. Physical checkup. If you have not had, you know what, let's change it to where we can't see my notes just because everybody can see that a little bit better. If you have not had a physical checkup for some time, let's say that you're just moved here to the college, you've never had a checkup before in your life, you're 22 years old and you decided to get pregnant and you were so excited about it and it's the first grandkid on both sides and you're like, I just don't know what to do, I don't have any brothers and sisters that have ever been pregnant, and you've never come to the doctor before, you're probably going to get a pelvic exam, you're going to get a pap smear. If you are at risk, you're going to get tested for sexually transmitted diseases. We're going to take into effect what your diet has been like, and we're talking about that a lot today. We'll be talking about that in some more slides of mine as well. How much exercise you get, what your weight is. If you haven't had a flu shot, we want you to have your flu shot. Getting the flu while you're pregnant can cause certain risks to you and to your baby. And we're going to say goodnight to those party nights. We're going to tell you to kick those bad habits because you need a certain amount of sleep and you need a certain amount of health in order to establish a good pregnancy. A good diet. Foundations for a healthy baby are laid before the moment of conception. A balanced diet with all of the vital micronutrients can help the baby's normal development in the womb. In an ideal world, we would receive all the nutrients we need from a healthy, balanced diet, but life is often far from ideal, and a hectic lifestyle resulting in missed meals, fast food, and recent pregnancies may all contribute to insufficient intake of those important vitamins and minerals that we have. If you are the person who is totally on a junk food diet, and that's the way it's been for a few years, we have some nutritionists and we have some dietitians that work with us that we can send you to, and you can go have a 30-minute consult with them and they will give you some ideas. Can I tell you one idea that I give a lot of the college students that are walking around? I will tell them, especially if they are struggling with nausea at the beginning of their pregnancy, I'll say, you know, if you link a protein with your carbohydrate for a snack, your blood sugar is going to go up and it's going to come down a little bit slower. If you just have some French fries or if you just have a piece of bread, a few minutes later your blood sugar will go up, but then it'll come down rapidly and your sugars will waffle a little bit more, and guess what that does to your nausea? Makes it a little bit worse. But in the back of your backpack, I don't expect you to be carrying a thing of yogurt if you've been to classes all morning, because that has to be refrigerated. I don't expect for you to be carrying a glass of milk, and you may not be able to get one on campus, or you may be able to not get one in your work situation where you're working. But if you will carry some raw almonds, not the wasabi ones that are going to give you heartburn, and not the cinnamon ones that are soaked in oil and then have sugar sprinkled on the outside of them, but some raw almonds, if you have a few of those, that helps you get a little protein there with your snack until it's mealtime. And so that's just a really simple nutrition tip that we have for you. Okay, so a few weeks ago, we had a patient that had a little bit of a reaction to one of her medications. And she told the other nurse practitioner, because the other nurse practitioner says, now come on, fess up what all of you had today. And she said, I had a couple NOSes. Well, I had not heard of a NOS, and I didn't know what a NOS was. So I went to Albertsons, and I was looking at all the energy drinks, and I couldn't find NOS. So I guess I have to go to Maverick to find a NOS. But I found lots of energy drinks. They're on the same aisle that all of the colas are on. So I went to this one called something Wired. The word Wired is in it. And I bought it because it was 88 cents. And so, whereas a lot of those energy drinks are $2. And so on this particular energy drink, it says maximum caffeine. And so it also says that one can is 2 servings. And when it breaks it down to what a serving is, half of that can had 94 milligrams of caffeine in it. So I will tease my patients sometimes because I have tasted Mountain Dew before and I think it tastes horrible, but I'm the worm in my little world of horseradish. Most of the world thinks Mountain Dew tastes good according to what I see when I'm leaving the stadium after a football game or a baseball game. Okay, there's a lot of green bottles there. Mountain Dew has 67 milligrams of caffeine in it. That same 12-ounce thing of Coke might have, no, Pepsi has 37 and Coke has a little bit more than that. according to the aisle that day that I looked. And then if you're getting the 16-ounce thing of Coca-Cola, you'll also, or Pepsi, or Mountain Dew, you'll also notice that it'll tell you that it's 2 servings, not just 1. And so that was kind of, I'm kind of old, but I'm still getting my education because I had never heard of a NOS before. So, and then those healthy cups of Joe's, I have a sister that came here to visit me, and she is a Starbucks girl. Well, I don't drink coffee, and so I had a little coffee maker that she can make some instant coffee at my house. And she says, I'm running into town. I said, Ray Chevron sells coffee and McDonald's sells coffee if you want to get your fresh stuff. So she and her husband went to town, and they were just so shocked that they couldn't find a Starbucks. And so they Googled it and put it on their GPS. And she called me about 10 minutes later. She says, I'm going to some place called Jackson Hole to find a Starbucks. But when she gets ready to establish pregnancy, she needs to kind of throw out some of those cups of Joe because it's just a little more of a stimulant than what you need. Eating some fish is a good idea. So there's a lot of literature out there. When you're expecting and you start Googling things, you're going to hear things like, well, you can't eat fish because it will give you mercury poisoning. So the data is there are certain fish that are raised in beds of mercury in the ocean more than others. Not too many of us have Uncle Guido sending us shipments of shark or swordfish. Those have lots of mercury in them. We can stay away from the mackerel and the king of tilefish as well. I don't think I've ever had king of tilefish, but when I've eaten out, I have had some of the other things to try those. However, if you're eating salmon, if you're eating heron, if you're having sardines, if you're having some tuna fish, you can have that a couple of times a week. And the omega-3 fatty acids in that fish are really good for you. And they're good for the baby's neurodevelopment, as in contentment, motion, and tone. Not only do you want a good, healthy baby, but you want a baby that's not crying all the time and a baby that nurses well. I wish I could tell you eating 2 tuna fish sandwiches a week would help your baby not be colicky, but based on my own little personal research, I can't give you any guarantees like that. Exercise, if you don't already have an exercise program, now is the time to start. And drink water before and during exercise. So David kind of mentioned to you that I've been a nurse for a few decades, okay? So there used to be some information out there that we used to give patients, and we used to say exercise, but don't let your heart rate get above 140. So 5 years ago, I had said that to a patient. Dr. Olga heard me say that, and he said, Becky, that's old information. And that is old information. What I tell the patients now is that don't let your self get too high or dehydrated. Even if you're just walking up and down Main Street on the parade on the 4th of July, have some water with you because that sun out there can really get you sunburned, can really get you dehydrated when you're exercising, when you're pregnant. And if you can't talk, and if you're feeling extremely fatigued when you're exercising, then maybe you need to slow down a little notch because maybe you're just going at too high of an intensity. And then wear supportive shoes and supportive bras because sometimes your ligaments are a little bit softer. And sometimes during the end of your pregnancy, you have a hormone called relaxin that is in your bloodstream, and you don't want to be prone to having to go visit your orthopedist with a spinal injury or back injury. You want to be careful and listen to your body, as Dr. Allred had suggested. Okay, I have a few patients that come in, and I'm trying to figure out how to say in a very nice way, your appointment with your dentist is long overdue. So part of normal preventative health that Christy mentioned at the beginning was to see your dentist a couple of times a year. You have hormonal shifts during pregnancy, and that bacteria that can get in the plaque can actually make you have quite red, swollen gums. And you can go to your dentist, you can have cavities filled, you can do anything you want when you're expecting. However, I do say stay away from the laughing gas, because we kind of like those molecules in your brain to be tied to oxygen so you have plenty of air supply. Once or twice in the long time that I've been a nurse, I have seen some ladies get too much laughing gas. And one lady was treated in Rexburg, and by the time she got to the freeway, she thought she was fine. She went out to the car, she was driving by herself. By the time she got to the freeway, she was really, really lightheaded. And she decided to go back, and at the dentist office they were able to check her oxygen. Her oxygen was really low, and they had to give her oxygen for an hour for her to be able to feel good and feel like she was able to drive again. So we don't want to do that when you're expecting. Get in touch with your roots. Now, what I mean by this is when you come in for that first visit, we're going to ask you some questions. We want to know if in your family history you have had babies with Down syndrome, if you have had certain problems with certain types of anemias. There's one anemia that is a sickle cell anemia. There's another that's called a thalassemia. And if you are of Mediterranean or Asian history and you have something called thalassemia, we're also going to want a blood test from your husband to see if he has that, because we want to predict what complications or what things we might need to be on the lookout for while you're expecting. We also want to know if you have certain bleeding disorders. And there are some tests that we can recommend and some tests that we can do, and if we know what your family history is, it's going to help you be able to get all that information and discuss it in your first or second appointment. If you're working out at the site and you have to wear a hard hat to walk into certain rooms, you might be exposed to certain environmental hazards that you will have to make some adjustments to before you become pregnant. There are pesticides that we want you to stay away from. There are cleaning agents that might bother you. There's 1 or 2 ladies that have been pregnant and they've been at that first little queasy stage. And there used to be a developer of, at the back of Walmart, before Walmart had gotten remodeled recently, there was a developer where you could go and have your pictures, you're printed like in an hour, and they could smell the developer from that and it made them sick. So what I say is if you have this cute little crib that you want to paint gray or you want to paint it pink, and you're in a room this big, there's probably going to be enough ventilation to where you're going to be okay. But if you're in a room the size of a bathroom, you're going to be overwhelmed by those fumes. So no matter where you are, no matter what chemical you might come in touch or in beside or smell, if it's making you nauseated, get outside and get some fresh air. And if you are expecting and your husband wrecks the car, because girls would never do that, right? Sorry, Devin. And you break your arm and you need to have an x-ray. If you're just at the beginning of a pregnancy, nobody's going to be able to tell that you're pregnant. Make sure you tell the technician that you're expecting and they'll put a blood apron over you. If you're at the dentist and the dentist want to take x-rays of your mouth, tell them that you're expecting. Most of the time the dentist is just going to wait till you've had the baby, because you only need those in your mouth once a year. You don't have to have those every 6 months, but your situation might be a little bit. Discuss the issues with your partner when you're planning for pregnancy. How will having a baby affect your life? How will it affect your finances? There are some people that might have 2 insurance coverages. At some parts of my life, my husband and I have both worked and we had 2 insurance coverages. There were some things we wanted to know. There were some things we needed to do. For example, my birthday was May 26th, his birthday was May 31st. We were 5 days apart from each other. But he had had his job for years longer than I had had mine. He was a few years older than I, but our insurance company said because my birthday came before his, I had the primary insurance. And so that tied us up a few months, and that would have been a really nice thing for me to know. I still would have gotten pregnant, I still would have had the baby, the pregnancy was still wonderful, but it would have been nice for me to make some of those arrangements and to be able to tell the doctor's office that I was the primary care before they had to go back and redo a bunch of work. A lot of things like that now we're on top of because we have electronic communication with your insurance companies. How are your living arrangements? Are you going to be moving the week before you have your baby? And childcare and those issues, it may not change whether or not you have your baby, but it may change the way you decide to communicate with your support system, the way you tell your family, help your family make plans, or it may change the way that you make arrangements with your partner. Okay. And then consider your mental health. Women who suffer from depression are twice as likely to have problems with fertility as women who don't. This was done by a study by a lady that works in a in vitro clinic. And then there is a little quiz that you can find online. There's actually several quizzes you can find online. But the name of one quiz is, Am I Ready to Have a Baby? That is a quiz that is put on a hospital website. The name of the hospital is McDonald Hospital. I think it's in Ohio, and it's just basically, Am I ready to have a baby? And it goes through about 20 questions that might be good things for you to discuss. Okay. I get a lot of questions about how do I toss the birth control, what do I do? Because I want to get pregnant, I want to have a baby. So, Depending on where you are in your birth control, most birth control is set up to make your cycles come every 4th week. There are some birth controls that aren't set up that way, that your cycles will come every 12 weeks, or etc. So if you want to not have any disruption and you want to be able to mark things out on the calendar as when I'm going to ovulate, when I'm going to have my periods, those type things, the only way that you can predict that is by keeping records. If the birth control is manipulating your body so that you can predict that, that's great, but that's not going to happen once you stop your birth control. Some people start ovulating and their medical word called return to fertility is immediately after they stop their birth control. And so if I were to read an insert that told me about that particular pill that I've given you, it may say return to fertility is immediate. Something may say if you had an IUD and you take that out, that return to fertility is immediate. If I read the literature on depot shots, which ladies will sometimes get every 3 months to help them not have a baby, the literature is going to tell me that return to fertility might be 9 months or might be 12 months down the road. But you know how we're not all worms sitting in that vat of horseradish? You might be a little bit different. But if you've come in and you quit and you've been having depot for 3 or 4 years, and for 2 months you've been trying to get pregnant, and you're really upset and you're blaming it on your husband, I might give you some information that makes you go, oh, I had a particular birth control. What I need to do is diary and give it a little bit of time because my return to fertility just isn't there yet. Some ladies are trying to time that baby. For example, I'm going to graduate from college in May. In September, my husband's going to start medical school on the other side of the country. I have got to have that baby in June. And I don't want to stop my birth control so that I have that baby in April. I want to stop my birth control so that next year in June I have that baby. That's really hard to do. So if a girl comes in and she has that list of things that she's got to do and she's got to accomplish, I kind of warn her that sometimes after stopping birth control, it takes your body a couple of months to be able to predict what's going to happen as far as ovulation. And I have her calendar, and sometimes I will even say, okay, stop your birth control a little bit early, use condoms for a couple of months, get on a regular cycle, get your body ovulating, and we'll take it as it comes, because I don't know one provider that's going to guarantee you that they can make you have that baby in June. Because once you get pregnant and you have that due date of June 15th, what happens if the baby comes early? And those things happen. And then a dating ultrasound can be scheduled. We usually like to do that somewhere between 7 and 12 weeks. But let's say you are, okay, so should I tell you a couple of things that like happen in real life? So a couple months ago, I made a lady really nervous and for about 5 minutes she was really nervous because I was giving her 6 weeks exam, meaning 6 weeks ago she had had her baby. And I said, have you and your husband been friendly? Because I know she hadn't started birth control, and she says, yeah, our baby was small, it was a little premature, and it wasn't uncomfortable at all. We've been friendly several times. Did you use condoms? No, we didn't. And I said, okay, before I start you on this birth control, I need a urine sample, and we've got to check and make sure that you're not pregnant. Okay, so her answer was, no, she wasn't pregnant, but it was a long 5 or 10 minute wait for her to find out that answer. Once, at this clinic where I work, I got to tell a lady at her 6-week visit that she did have a positive pregnancy test. And so, how was I to know when she got pregnant? We have dating ultrasounds and we can tell her how far along she was. Let's say another lady comes in and she has 3 or 4 periods a year. She's just really irregular, but she's not worried about it. She's young, and if she gets pregnant, she gets pregnant, and if she doesn't get pregnant, she doesn't get pregnant. The breasts have been tender, she's been nauseated, and she wonders if maybe she's pregnant. And I say, give me a little sample of your urine, and we'll stick a little test in there. We'll stick a little stick in there, and we'll tell you. And the little stick turns a certain color because the hormones have changed. And I come back and I say, I know you're pregnant. When was your last period? And she goes, last September. And now it's January or it's February. I'm like, we need to do an ultrasound and we need to see how far away your baby is. When I was having babies, this was an option that was available, but the technology is so wonderful now that we can give you a due date estimated on what we can see with the baby and what measurements we can take. As your body changes, So here is a little before and after. Your body's going to be doing lots of changes. So as your body changes, you will get tired. Your body, you will sleep differently in the position in bed. You won't be as comfortable as you were, depending on where you are in your pregnancy. Or you have found yourself so profoundly tired that you're like, I could sleep on a couch upside down for 6 hours straight because I'm 6 or 7 weeks pregnant and I just feel tired and I don't know why. Some of that may be normal, but we have lab tests that we take to make sure that your thyroid is behaving, to make sure that your blood supply as far as iron and anemia is behaving, and we kind of keep track of you that way. And I will just close. There was a darling little picture that I found in a magazine, and I didn't put it on my slideshow because of patent things, but the name of the article was Baby Love, and look at this sweet little baby. And the mom said, the moment I met Thomas, the world stopped. I fell in love. We kept his gender a surprise, and I was incredibly happy to have a boy. We also have a 2-year-old boy, Nicholas, and that's the best part of it, that I have 2 wonderful sons who can grow up together and be in each other's sidekick and each other's best friend. As soon as Thomas came out, I thought, wow, he's mine. We made him. It's an overwhelming feeling as a second-time mommy. I was more laid back, but that feeling still blows my mind every day. And I'd just like to close with, the most precious jewels you'll ever have around your neck are the arms of your children. Are there any questions? Okay, thank you.